My next two speakers, between them, have about 35 years of haematology nursing experience. And they are going to talk about living long-term with myeloma. Trish Joyce is nurse consultant with myeloma and autologous transplant service at Peter Mac VCCC, while Nella is nurse consultant with the myeloma service at Peter Mac VCCC. Nella is also project manager with the Australian Cancer Survivorship Centre. So both of these ladies are well qualified to talk about our next topic of living long-term with myeloma. Welcome, Trish and Nella.
Thank you. Thanks, Tash. Thanks, Laura. And thank you so much for having us here today. We're at Peter Mac today. It's been a busy day leading up to a long weekend, but we hope that everybody here is able to get something out of the presentation. We have prepared some slides, but we'll also keep it fairly informal and casual, and there will be plenty of time at the end for people to ask questions. Yeah. Right. I'll just get this internet clicker working. Doesn't seem to be working. Is there able to change the slides for us? Thank you. Thank you. So what we would like to cover today in this session is the importance of supportive care in the context of a changing myeloma landscape. We're going to talk a little bit about a clinic that we have recently started at Peter Mac called the Living Better with Myeloma Clinic, which is a nurse and pharmacist-led clinic. We'll also provide some practical tips to manage symptoms and enhance supportive care, which we hope will be helpful to everybody at home listening in today. We'll talk also about the benefits of early referral to palliative care in symptom management and supportive care for myeloma, as well as the role of other health professionals, your GP and support organisations in supportive care and living well with myeloma. Thank you. So firstly, we'd like to start with what is meant by supportive care. What are we talking about when we use that term? It is a bit of a medical term, so we've provided a bit of an explanation here on the slide to hopefully bring it into a bit of context, and you can think about this in terms of your own experience of living with myeloma. When we're talking about supportive care, we're talking about the prevention and management of adverse effects or unexpected events, effects or side effects of cancer and its treatment. And this is wide-reaching. It's not just talking about the physical effects of cancer and its treatment, but also psychological symptoms and side effects from across the cancer journey, all the way from diagnosis through to post-treatment care and all that's in between. The aim of supportive care is really to improve the quality of rehabilitation, so getting better after cancer and during cancer treatment or afterwards, preventing secondary cancers, survivorship, and also end-of-life care. So it's really quite broad, and it's talking about all of the different aspects that contribute to our health and well-being. And it's not just in terms of the person who has myeloma, but also those who are also affected by myeloma, our partners, carers, family, and close friends.
Great, thanks, Nella. So why do we want to focus on supportive care for our patients, particularly living with myeloma? And we know that there's a lot of research, I guess, out there that tells us, particularly that patients undergoing blood cancers, and especially people that are living with myeloma, deal with a lot of challenges. And that can change during the, you know, your journey, if you want to call it that, through the illness experience. So at the beginning with your diagnosis, there can be the shock, the disbelief that you've got this, you know, chronic disease. Then there may be the pain associated with the disease, the fatigue, and then of course we bring you in and start you on treatment. So this study, which was a very large cohort, including thousands of patients with blood cancers, but particularly it also included myeloma patients. And it tells us that there's a huge, broad-ranging number of, you know, symptoms and challenges. If you look at the physical, there's the pain, the fatigue, the anorexia, the nausea that's caused by the treatment, decreasing your, you know, physical functioning, not being able to do the roles that you once did. And then that can all impact on your psychological well-being and the anxiety that that creates amongst the person that's going through the illness, but also, you know, their family and their carer. And then that also impacts on, you know, your spiritual well-being and, you know, those existential questions that we all ask ourselves and, you know, the meaning and why me. So there's a lot of evidence to tell us as healthcare professionals that our patients, you know, living with myeloma particularly are faced with a lot of symptoms. And particularly for myeloma patients, there is a very high symptom burden. And the onus is on us to be able to help you through that. So that's why we really wanted to put that slide up to show you that if you are having a bad day today, you know, there's a good reason for it. And there's lots of evidence out there to say that that's the case, particularly when you're living with myeloma. But also, there's a lot of things that we can do. I might go to the next slide. So we thought we'd take a step back and talk about where we are right now when a person gets newly diagnosed with myeloma. So usually the standard of care here in Australia, it's slightly different in North America and in Europe. You're either suitable to have a transplant or not. So that's the first question that will be discussed at this point in time. There's lots of exciting treatments ahead, and that's very likely going to change into the future. But right now, that's what we have. And so then the person would have maybe 3 to 6 cycles of a combination that you're all probably familiar with, which is Velcade, Revlimid or lenalidomide, and dexamethasone. Had stem cells collected, stem cell transplant, and then on to some maintenance treatment. So there'll be variations of that for each person. It's not one size fits everybody. And we like to think that as clinicians, we're able to give really individualized care for each person. But as you go through all of that, symptoms arise, side effects happen. It's not just related to the myeloma itself, it's also the treatment, and it's how you react and respond to the treatment. So you can see that arrow that we've put at the bottom of those boxes is defining supportive care. And so supportive care, which we consider is absolutely a priority, goes all the way through from when we first meet you with the disease, and you start treatment and all going well, going to a remission, and then on to your maintenance part of your therapy. So supportive care will be the backbone of managing your symptom burden throughout all of that. And I guess, you know, lots of you on the webinar today, you know, there's lots of different treatments out there. There's lots of very exciting treatments coming. And we put that slide up to say there's a whole sort of landscape of changing treatments that that will grow and become the new standard of care. All of these treatments will have some kind of side effects. And for where you are right now, if you're on maintenance versus going on to consolidation, or even, your induction. So supportive care is really going to be able to manage, and to treat and help, lessen the symptom burden for you as you go through whatever treatment you're on. And just on to the next slide.
Oh, sorry, I'm doing it and the CBP people are doing it too. So maybe I'll just stop and we'll go back one slide, please.
Thank you. Oh, maybe just forward one.
Oh, no, this is right. Never mind. So, as Trisha's mentioned, there are the treatment options for myeloma, and the way that we treat myeloma is changing. And it has changed if we reflect back even the last 5, 10, 15 years.
Yeah.
And we know that people are living longer with myeloma, and often have periods where they are on treatment for long term, and they may go from one treatment to the next treatment without a break. Sometimes there are breaks in between. Everybody is different. But there's a role for supportive care throughout all the different phases of myeloma, the myeloma journey. And they will change over time, and so priorities will change. And so our role as health professionals is to work with you to make sure that at each stage we are trying to address and manage your supportive care needs at that time for what is important to you. What we have, what you see here is just the different phases as we kind of have tried to conceptualize it. And the one there that we've circled is the one that we have been focusing on, that particular phase in the myeloma journey, and our patients who are either on maintenance or have stopped treatment for a treatment break. And really trying to take that opportunity while things are stable, and focus on enhancing supportive care and identifying priorities with patients about how to maximise their health and well-being. And we'll talk a little bit more in detail about that as we progress through. Next slide, please. Did you want to talk about this one, or was I can't remember.
Yeah, we can talk together. Yeah. I guess this is, as we've been talking, this is another review article, again, just highlighting to us as clinicians, because our job is to better look after our patients and to try and improve your quality of life, to help you get from A to B, whatever that part of your journey is. And when I look at a slide like this, I see that we as clinicians could do it a lot better. And so that's really been the impetus for why Nella and the myeloma team here have started this special clinic. It's the supportive care clinic, or almost a survivorship clinic. And we'll talk a bit more about that. But again, this was another study, and it really highlights again how you living with the disease have lots of needs, including physical, emotional, the daily practical stuff, getting in and out of the hospital for your treatments. That can be a major challenge, particularly at Peter Mac with all of the roadworks that are currently going on. Lots of informational needs, and a lot of these needs are not met by us as clinicians. So I think it's beholden on us as clinicians to think, hey, hang on a second, how can we do this better? How can we improve your quality of life to make your life living with the myeloma as easy as we can for you? So that's really all what that slide is saying. But it's really about just setting the scene about and the impetus of why we looked at establishing this special clinic.
And when the researchers who were doing this study were looking at the unmet supportive care needs. The ones in the purple there with the circles and the ovals, we're looking at all people with blood cancers, so not just myeloma, but also included lymphoma and leukemia. And then, oh, sorry, I just need to move the mouse. And then the ones on the right in the blue boxes were the most frequently reported amongst the subgroup of people with myeloma who were included in the study. And since starting working in the survivorship area as well, many of these needs are felt by other people and experienced by other people who are living with cancer and after treatment. However, we know that myeloma is somewhat different in that the treatment continues and that people have many lines of treatment. And so, as Trish mentioned, there's a lot that we can do to support you better. Next slide, please. So we wanted to also bring in and talk a little bit about how palliative care relates to supportive care and also in the context of myeloma. So the integration of palliative care in the hospital system is changing. It is commonly misunderstood as only appropriate for end-of-life care. However, this is not the case, as palliative care experts are also very, very experienced and skilled in symptom management and supportive care. And we actually find that it is much more beneficial to integrate this in as we're delivering supportive care for our patients, because they can bring a lot of value to the patient care and the symptom management. Next slide, please.
So it's funny, palliative care is a funny word and has different connotations for all of us. But and it has its origin back in the first hospices that were set up back in the 60s in the United States. But current knowledge and research shows that palliative care is important for end-of-life care. But also some very recent research shows that if you use palliative care and introduce that specialist team right at the start of a person's journey with cancer, and it can be any type of cancer, it actually improves patients' well-being, it improves their quality of life, and the specialists that are working in a palliative care team help us as clinicians to manage our patients' symptoms better. So it's all about optimizing that person's quality of life, making sure we get control of their pain, manage their nausea better, give them advice around, fatigue management. These are all really, important elements of a person's, journey with myeloma that need to be managed and need to be discussed in the clinic, and need to be, you need to discuss, recommendations. So palliative care now is being introduced much earlier. I might just go back because I haven't gone through the definition, but this is a nice WHO definition from the World Health Organization. So it's an approach that improves the quality of life of patients and their families who are facing the problem associated with a life-threatening illness through the prevention and relief of suffering by means of early identification, assessment, and treatment of pain, and of course of other symptoms. And not just physical, also includes psychosocial and spiritual. So that's why as clinicians, and particularly in the myeloma landscape, we are all, really supporters of introducing the palliative care physicians and specialists to meet with our patients much earlier on than we would have, let's say, many years ago. And so the next slide, please. Right, so again, yeah, we were involved in the study here at Peter Mac called the Care Plus study. That completed last year. It included patients with myeloma and their carers, and it looked at the early referral to palliative care for newly diagnosed myeloma patients. And the benefits, all of our patients and their carers really felt it was beneficial. They knew it helped them understand what palliative care was and what palliative care offered. Some of the patients in that study had just a one-off appointment and their symptoms were well managed. They didn't need to connect with palliative care again, but they knew that if they did want to, they knew who that palliative care person was. They could ask, could they make another appointment to see them? So that can be really empowering for you as a person when you know, okay, I think I'd like to go back to that doctor because he was really good and gave me some really good recommendations and managed my pain really well. So we want to empower you, guys. You guys are the expert to help you know who you need to call on to help improve your quality of life, manage your symptoms better, because that's really what's so important as you get through your treatment. So you can remain as well as you can and keep that treatment cycle on schedule. Yeah, so it's that holistic approach that palliative care is really all about.
Next slide, please. So now we thought we would talk a little bit about our Living Better with Myeloma clinic. And we'll then go through some of the elements that we cover in the clinic consultations, which are very much linked with supportive care and what we've talked about so far. So the aim of our clinic was to establish a nurse-led clinic and multidisciplinary, meaning that we also have other health professionals involved in the clinic who are not nurses, such as pharmacists and doctors. And it's really for patients whose myeloma is in a good remission. They may be on treatment or off treatment, but focusing in on supportive care, health promotion, preventative health and education. Our clinic can be delivered or held either face-to-face or on telehealth. And as I mentioned before, we've got nurses, pharmacists and doctors involved in the clinic at certain time points. We identify the supportive care needs and the patient priorities in this clinic with the patients and their carers. And that really forms the basis of the care plan and the goals that we set. We try to get the pharmacist to see you or our patients beforehand. That's usually a telephone call a couple of days or up to a week beforehand to go through current medications, identify any side effects that you might be having of those medications. The pharmacist can also offer advice about how to manage medications and help our patients if they have questions regarding their medications. And this information is really helpful for us to have before the clinic so that we can focus on other things. And we know that we have a great pharmacist here who's really knowledgeable and has made some great recommendations to our patients. And then we can also follow up with them in the clinic and see how they're going with that.
Also, I mentioned as well, Nella, that we do what we haven't instigated yet, but our plan is also to get our patients to fill out a survey before they come to see us in clinic. And I guess that's important information because it gets them to have a think about what are their priorities of care, but also what are their top sort of symptoms, or what are the things that are really dragging them down now. So then that gives us some opportunity to get that information in a week or two before Nella or I would see the person in clinic, so that then we can really have a dedicated, targeted discussion about what those issues are for that person at the time and work to try and manage them better. Yeah.
Right. We do have quite a bit of time set aside for these consultations. We only started in November, so we hope that with as we progress through and we start to see patients coming back to our clinic after 3 or 6 months, that the consultations will become a bit shorter. But we have the time there to really explore the patient's needs and take a detailed history of how these different side effects, persistent side effects, have been affecting them. Because sometimes we're finding that it's actually the first time that people are mentioning some of these side effects as well, because we have the time to explore them in more detail, and we're prompting for discussions about things that maybe we haven't spoken about before.
And I think sometimes a point I would like to add is medical appointments are often very quick and they're very rapid, and often as myeloma nurses, we don't always get the opportunity to sit in with the doctor. So that's another reason why this dedicated clinic towards addressing the person's, supportive care issues or whatever you want to call it, also was one of the reasons why we set that up, because sometimes that appointment to see your consultant can be so quick. You walk out of the clinic and you think, oh my goodness, I never asked this, and this. So this is really a great way to provide that holistic opportunity to be able to sit down and talk to people in detail.
Right. And now the next slides that we're going to go through are different elements that we cover in the clinic. It's not everything, but we thought that these would be particularly helpful for the audience today to know. And also we hope that it provides some information for you to be able to take back to your own healthcare setting, whether it's some things you might like to discuss with your treating team at the hospital or with your GP, because we work very closely with primary care and general practitioners in this clinic too. So firstly, we have a slide here about reducing the risk of infection. We know that people with myeloma have an increased susceptibility to picking up infections, and that spans across the whole myeloma experience, even when people are off treatment, even though there may be periods of time where you are more susceptible to infection. It's something that we do need to be aware of in our patients all the time. So we like to take a bit of a history of vaccinations and where people are up to with their vaccinations in this clinic. And at the moment, we're just heading into influenza season, so we're talking a lot about the seasonal influenza vaccines and recommending our patients go and get those as soon as available, and keeping up with COVID-19 boosters too. The other thing is the Shingrix vaccine is now available on PBS, so a lot of our patients are going back to their GPs to organise those. Sorry, Trish.
There's also, we put down there the RSV vaccine, and some of you will be hearing that mentioned maybe even in the news or in different sort of literature and sort of social media. It's got FDA, it's been approved and it's safe and it's not a live vaccine. RSV is the respiratory syncytial virus. Particularly, it seems to have spikes in the winter months, and it can be quite a significant virulent infection. So this is a vaccine to help prevent that. Just to point out, ATAGI has approved it, but it's not PBS approved yet. So unfortunately, you can only get it on a private script. And it's just 1 dose, but it is expensive currently at the moment. I think it's around about $200. But it's one vaccine, and I think it's lasts for up to 2 years. So that might be something you might want to, consider, or you might want to have a chat with your myeloma specialist doctor about. But yeah, we just put it on there because there's a little bit of, talk about it now in the community. And I guess as we get deeper into winter, we'll hear about that a little bit more as well. So, but unfortunately, not yet on PBS, but hopefully that won't be too long more before it does. Yeah.
Great. And then, as you can see there are a few other things that come under the infection banner. We can check immunoglobulin levels if they haven't been done recently. Our pharmacist usually will review what preventative medications, antimicrobial prophylaxis. We didn't change, that's a very medical term.
Yeah, it is.
Preventative medications for protecting you against infections, as well as ongoing education about how to keep yourself as well as possible.
Exactly. Yeah.
Okay, next slide, please. Oh, sorry, did you want to add something, Trish?
I guess, as Nella pointed out, we're coming into winter, so making sure all of your household contacts as well, that's something that we really now start to, educate our patients and families about. So trying to create a ring of protection for yourself. So that's why we really encourage household contacts as well to get vaccinated.
Okay, next slide, please. Bone health is also something that we cover in our clinic. We look at where people are up to in terms of their bone strengthening medications like Zometa or Pimidronate. We provide education about the importance of keeping up with daily dental hygiene and regular checkups with your dentist to keep your teeth as healthy as possible. And if you need any dental work, to make sure that our patients check with us first, and we can make a decision about what to do with their bone strengthening medication in order to get that dental work done. We can check some blood levels for vitamin D and calcium, which are important for bone health. And if they're low, then we can work with the medical team to implement some supplementation. As well as, and this crosses over into exercise, which we have on another slide, but incorporating weight-bearing exercise into your routine is also important for bone health. And so we do talk to our patients about their exercise and how to optimize, make some, small changes to target weight-bearing exercise if they haven't already got that as part of their exercise routine. Yeah, next slide, please.
So in our clinic as well, there's a good or a big focus on preventing other illnesses and diseases. And that's one of the reasons for that is that we know that anybody that has had a cancer and cancer treatment, they will have a slightly increased risk, and that's very small, of developing a secondary cancer down the track. So it's good to know that. But the important thing is that we have really good screening programs in place. And one of the focus for our clinic is to make sure we discuss that with our patients. Particularly our patients, that have been on treatment and now on their maintenance and doing very well. They're back doing normal things and back at work. Sometimes with the tyranny of the busyness of everyday life, we forget about little things like this, and these are really important. So there's excellent screening programs for bowel, skin, breast, cervical, and prostate. And so much of our time as well in the clinic is discussing why these are important, why it's important to follow the national recommendations for cancer screening for the various sort of diseases such as colorectal cancer, skin cancers, breast, cervical cancer, and prostate. So I think it's often, you know, scary to hear that, especially when you're going through one cancer, you don't want to get another one. But I think be reassured and feel empowered that a screening program is that. It's to help keep you healthy, keep you safe, and to pick up on things early where we can, you know, do something that's, you know, with little intervention. So that's a very important part of our clinic as well. And then we work with the GP, because your GP is a really important person in your care. And we communicate the discussion that we have with the patient in our clinic with the GP, but checking other elements of your health, such as, you know, monitoring your blood glucose, monitoring your cholesterol levels and your lipid profile, just making sure that we reduce the risk of cardiovascular disease, checking your thyroid function, which is important after various types of treatment, all with the focus of keeping you healthy and identifying things early on where we can do something really meaningful to manage it, very straightforward for the person. So the focus is on, you know, education, you know, making sure that you understand what, you know, elements of health screening you need to undertake, and putting a plan in place for that. And then it's all about healthy lifestyle as well. It's about, you know, making sure that you try and, if you are a smoker, that you stop smoking because of the benefits to your health. You know, a healthy approach to alcohol intake, and also recreational drugs. So these are all sort of elements that we discuss in, you know, they're important for a healthy lifestyle for all of us. But yeah, it's and we feel that in this clinic, it gives a good, you know, gives time to be able to address those things for our patients in a bit more detail.
Next slide, please. Another aspect of our clinic is around sexual health and intimacy. So we always take some time to discuss this with our patients, and we're very much guided by how comfortable people are talking about this. But we want to create a safe place where people can talk about their sexual health and intimacy and bring up any questions that they have or concerns. Some of the concerns that we have been that have been brought up so far are listed there. So decreased libido, erectile dysfunction, vaginal dryness, uncomfortable or painful intercourse, and relationship problems. Now, we know that all of these things can impact various aspects of somebody's health and well-being, and not just physically and emotionally, but also socially too, and are important aspects of us feeling healthy and good and living well. So whenever we identify one of these concerns in our clinics, we are able to refer people on for management and support. And we've got some really great clinics here at Peter Mac, but we also have other supports through communities and through GPs as well. So we want, I suppose, for people listening in today, this is definitely something that you can discuss with your treatment team. It's not something that you have to just deal with or accept as part of as a long-term side effect of treatment, or something that you're still experiencing. And we want to know if this is a problem. And so if you are experience any intimacy or sexual health related issues because of your cancer or treatment, please bring them up with one of your doctors or nurses.
Yeah, I agree, Miller. It's an underreported concern that patients report. And I think that's precisely because we as clinicians maybe don't create that right environment or ask the right questions. But as you said on the slide, there are so many things that we can offer the person to be able to manage, you know, all of those concerns that are on that slide. And again, can, you know, can really improve, your well-being and feeling, better about yourself.
Next slide, please.
Okay, so emotional health and mental health. So it's a marathon, isn't it? Living with a myeloma diagnosis. The good news is that as Mela said at the start, the treatment landscape is changing. The outcomes are improving. We've got a lot of exciting treatments to come, and we've made so much progress in how we manage this disease up to this point in time. But that's not to take away that, it's very up and down. We understand that there's so many challenges along the way. And those challenges can be different depending on where you are in your journey. From the shock of diagnosis to the fear, is it going to relapse if you've gone into a remission? It's about how you manage that uncertainty. And I guess that slide is, that they're, showing all different ranges of emotions, frustration, anger, sadness, depression, and we know that there are so many challenges that a person can, face along the way that contributes to, how you manage your mental health. I think it's a very important part of looking after you. I think our physical and our mental well-beings are so intertwined that, we have to take a holistic approach. So it's something that we discuss with our patients all the time, particularly, it's a focus in the clinic, but it's about trying to, talk about how you're feeling, how your mental health is going, and talk about, what kind of supports that we can put in place. And there are lots and lots of places that you can seek support from. I think really the first thing is, just, putting your hand up and saying, I am having a tough time. And that's really, really okay. And, and just normalizing that anybody going through, a cancer journey do face, challenging moments. GPs are great. They're a really great resource, and if you don't have a GP, we would strongly encourage you to get one. Talking to your GP, setting up a chronic healthcare plan is really important, where you can access some specialist care or specialist consultations, such as a psychologist, which can be subsidized, so they can be really helpful for you. And then, of course, we've got the wonderful Myeloma Australia and, the support groups that are out there that you can access. And that peer discussion and that sort of that close contact with people who are going on a similar journey can be really invaluable to share, how you're feeling, and know that somebody else going through the same journey is feeling exactly the same way. So again, it's important to, to let your treating doctor know, your treating nurse know, because there's lots of supports out there, and it is a very normal thing to feel lots of those emotions that are they're shown on the screen.
Next slide, please. I don't think we need to spend too much time talking about sleep and the effects of myeloma, its treatment on sleep, because we probably all know that very, very well. So what we do want to highlight to you, though, is a really great resource there that's on the screen, a booklet. If you are still having sleep problems, whether you're on treatment or not, there's some really great information in the Can Sleep booklet there, which can be downloaded via the Peter Mac website, and with lots of practical strategies and help, and it's applicable to anybody. You don't have to be a patient at this hospital. Recommend that you have a look and see if there's anything there that can help you. Next slide, please. Physical activity is something that we also talk about in our clinic. We recommend that our patients be as physically active as their current condition allows, and we try and work with them to set some goals around exercise as well, and enhancing their exercise, either the time that they spend exercising or the type that they do. A lot of people find that they want to exercise, but there are limitations. And so we can also refer to physiotherapists and exercise physiologists, or ask the patients to organise those through their GP to get that expert input. Next slide, please.
This slide is talking about kidney health, and some people living with myeloma can have some kidney impairment, or their kidneys may not be working as well as they should normally, and that information would be known to you and discussed between you and your doctor. I think for even people that don't have any kidney impairment, looking after your kidneys is so important, because we know that when particularly myeloma is active, the actual protein itself can sometimes damage the kidneys. So really good way to think about your kidneys is they're two big filters, and you need to flush them well. And so keeping up a good fluid intake, really important. Your doctor will be having a discussion with you, and certainly in our clinic, we will be discussing the blood results to let the person know what their kidney function is doing, and that's an important question you can ask your doctor. If you do have kidney impairment, or your kidneys are a little bit stressed, and you know that's what they've been like, it's really important that you avoid, certain medications, or, IV contrast that we use for some scans. So these are important things to avoid, particularly drugs. It's a mouthful, non-steroidal anti-inflammatories, but drugs like Nurofen, and I'm sure you would have known that, but it's really important that you stay clear of those kind of drugs. Some over-the-counter supplements are absolutely fine, but some can sometimes, because we're not quite sure what's in them. So really important, again, that's something we would discuss with our patients and take, with our pharmacists on board in the clinic, find out, what are there any elements in those supplements that could potentially, cause the kidneys to get stressed more. And then, of course, you're all on probably what we call a bisphosphonate, or a bone strengthener called Zometa. The other name is pamidronate. And monitoring your kidney function, a really important part of prior to any dose of Zometa or pamidronate, depending on the frequency you're having it. Yeah. So next slide.
Yep, and pain and neuropathies can persist long-term or fluctuate over the course of myeloma journey. And these can be the nerves, the motor, sensory, or autonomic nerves affected. The motor being the ones that control movement of your body, sensory ones picking up sensations and sending them from the external world, sending them to the brain for processing, and that's how you feel them. And autonomic are less talked about, and they're the nerves that control our sort of internal functions, like our digestion and our sexual organs as well. So Myeloma Australia actually have a wonderful resource called Managing Peripheral Neuropathy, which covers all the different types of neuropathy as well. So if you haven't already had a look at that, really recommend you have a look via their website. It's real if you are experiencing any sort of nerve sensations or any of these funny feelings or problems with your digestion or blood pressure, let your doctors and nurses, your treating team, know. They might need to change some things, some medications if they are actually contributing to those symptoms. There are some treatments that are available. Some can be medications or other strategies, and referral to a specialist neurologist may be indicated, as well as pain and palliative care teams can be really beneficial for people who have ongoing pain or neuropathy too.
Yes, we're conscious we've gone over a little bit, but we're nearly at the end, so just bear with us. We've just got a couple of more slides to go.
Next slide, please.
Yep. So this is your care team, and so it's all about trying to set yourself up with a team of people that's on your case to help you and support you, through your journey with myeloma. So getting a GP, having a GP is really important. Making sure you're comfortable with that GP. With the interface with our clinic, and when we see our patient, we always give them a copy of the care plan that we discussed with the patient. That gets sent to the patient as well as the GP, and then any follow-up elements of the person's care that can be done locally, we will always document and communicate that on the care plan and on the letter that's sent to the GP. So, for example, things like when their next vaccines are due, any medication changes, any medication suggestions, what we discussed about the cancer screening plan for the person at the time, monitoring for other diseases such as diabetes, cardiovascular disease. So all of that is documented in that plan. And patients anecdotally have fed back to us that they feel that it's a very comprehensive, and they actually, like the fact that there's really clear, good communication between the treating myeloma centre and the GP. And also, if we will also document in the care plan if we refer that person to another specialist in the centre.
And then next slide, please. And then finally, your care team also includes other health professionals like allied health and specialists like Trish has just mentioned. We may include and refer on to cardiology, or if someone has a problem with their heart, or respiratory if they're having lung problems, or neurologist for nerves. Community organisations such as Myeloma Australia offer an amazing amount of support. There's only so much that the hospital can provide often, and GPs, and we can't stress enough the important role that these organisations have in living well with myeloma and maximising supportive care. So please take the opportunity to explore all of the offerings of all of the organisations, because they're there to help you, and they have excellent resources and amazing staff, as you know. Yeah. That brings us to the end of our talk. Thank you so much.
We'd love to answer any questions or hear any suggestions or any comments.
Thanks, Trish and Nella. That was really enriching, and I certainly learnt a lot. We've probably got time for one question, which is quite important. Is it are patients able to self-refer to palliative care?
That's a very good question, Tash. And I think they would need a doctor's referral, as in by the GP. And certainly if they wanted to do that, let's say they were a patient at Peter Mac and they wanted to access a palliative care physician here, of course, they would be absolutely, they can come and speak to one of us. We would need to do the formal kind of referral pathway. But I would think, Nella, that you could do it in the community as well by a GP. But it probably would, I think you have to think about how it would work best for the patient. So I think the patient, where the person is having their treatment, it would be optimal for that person to be linked in with a palliative care physician within that centre, so that there's really good communication back and forth. Sometimes even now, Nella or myself will sit in with the palliative care doctor when they're seeing one of our patients. And I think that's critically important, so that we've got the person in front of us. We're coming from slightly different disciplines, but the goal is to improve symptom management and optimize that patient's quality of life. So I would say that it would be best done within the centre that the person's having their treatment, and 100%, if that's what that person feels they need, they just need to talk to their doctor and their nurse. But yeah. Would you add anything else?
No, I think you covered that really well, Trish. Yeah.
Yeah, that sounds fabulous. And I love the discussion of the teams communicating with one another. And I love your group's plan for the GP, because I think that's something that's really lacking in our general community. So some great ideas for our patients to take back to their usual treating centres. Thank you very, very much for taking time out of your very busy day. Laura and I realised just this week that we put this session into Easter week, and all health professionals are really, really busy in the short week. So we really, really appreciate it. Thank you very much.
You're very welcome.